Different scans you do during pregnancy and why you do those scans. Are you pregnant at the moment and you're wondering what scans to attend? Make sure you watch this video to the end. Hello everybody, welcome back to my channel. Today we are talking about the different scans that a pregnant woman needs to attend. When you're done with these scans, you have covered all the ultrasound you need to attend during pregnancy. People who have higher risk pregnancy might need to attend more scans. And if you're someone who thinks ultrasound is not important during pregnancy, maybe this video is going to help you change your mind, because yes, ultrasound is part of the things that helps you when you are pregnant to know whether your baby is healthy and also to guarantee that you are also healthy. Your healthcare providers want you to do ultrasounds, so make plans of attending them. The first scan you want to attend when you are pregnant is the early pregnancy scan, which is done between 6 weeks and 8 weeks of pregnancy. This scan is important because it helps to know where your baby is growing. It also helps to know whether your pregnancy is single or multiple. It also helps for you to have an accurate estimated date. So many people wonder why this scan is one of the most important scans in pregnancy. I hope my explanation helps you to understand that. So between 6 weeks to 8 weeks pregnancy, attend a scan, get your dates, number of babies, and also where the pregnancy is located. The second scan you want to attend is between 11 weeks and 14 weeks. This is the first trimester anatomy scan. This scan is also one of the most important scans to attend when you are pregnant. The reason for this scan is to check the nuchal translucency. Nuchal translucency is the fluid at the back of the baby's neck. This fluid is measured during this time. The measurement should be less than 3 millimeters. If the measurement is above 3 millimeters, then it heightens concern for chromosomal abnormality. Chromosomal abnormalities happen in certain pregnancies. So when we talk about chromosomal abnormalities, we are talking about things like Down syndrome, Edwards syndrome, Patau syndrome. These are things that can make a child to be special need or need more care when they are finally born. Some chromosomal abnormalities can even lead to stillbirth or a child not being compatible with life at the time when they are delivered. So you having the information about this is really necessary for you when you are pregnant, because it will help you to make right decisions and also get help when needed. But there is one thing you need to know about this nuchal translucency measurement. It is not a confirmation that your baby has a chromosomal abnormality. It is a marker, like something that points to possibility of chromosomal abnormality. So if you go for that scan and your baby's nuchal translucency measurement is more than 3 millimeters, then it raises a lot of concern. More tests will be done to confirm if truly your baby has chromosomal abnormalities or not. If you've watched this video to this point and you love what I am doing, I would like you to like this video and share to a friend. I would also like you to subscribe to my channel, because I'll be bringing you a lot of videos to teach you about the importance of ultrasound and also your fertility at large. You might want to watch other of my videos that speak about trying to conceive, that is if you're a trying to conceive woman. If you're pregnant right now, I also have a lot of videos about symptoms in pregnancy that you didn't know about. Those videos would equip you with a lot of information navigating your pregnancy as well as your fertility journey. However, this scan is of utmost importance. Other things that I check during this scan is the parts of your baby's body to make sure that they are complete. Certain babies might have certain body parts missing, and this particular ultrasound will help to know whether your baby has all their body parts intact. The next scan, which I would usually call the most important scan during pregnancy, is the second trimester anomaly scan. This scan is done between 18 weeks and 22 weeks of pregnancy. I have done some videos about this particular ultrasound, and you don't want to miss it if you are pregnant. Even if you say, I want to miss other scans, so this particular one, you don't want to miss it, because it shows about 80 to 85% of possible anomalies that can be wrong with the baby. Just imagine not going for this scan only for you to give birth to your baby and they are finding out that the child has an issue that would have been seen during the 20 weeks anomaly scan. What are the things that are looked at when you go for the 20 weeks anomaly scan? Things like the placenta location, the baby generally, your womb structure, and we check the baby's brain and the head shape. We check the face of the baby to see whether there are anomalies of the face like cleft lip and palate. We also check whether the baby's heart is pointing in the right direction, whether the chambers are complete, whether your baby has heart conditions that can be affecting them. The lungs of your baby is checked at this stage as well. The stomach of your baby, the bladder, the limbs, up to counting the fingers. This is what is done during the 20 weeks anomaly scan. That is to show you how in-depth this ultrasound is. Every woman who is pregnant should plan to attend this scan. If you are somebody that would usually eat the money for your scan, you don't go for it, you just collect money and you don't go for your scans, this particular one, you don't want to miss it for anything. Plan to go for it. In certain countries, it is offered free, while in some, you have to pay a lot more money for this anomaly scan, more than the normal scans you do. So your normal scans might be costing lower than the anomaly scan, but it is better for you to attend this anomaly scan than every other scan that you might want to go for entertainment purposes. This is also the time when ultrasound can give you an accurate gender of your baby. So if you want to know whether you are carrying a baby girl or a baby boy during your second trimester anomaly scan, that is when this is visualized and told to you. So this is also a good time for you to know the gender of your baby if you want to know. The next scan is the third trimester scan, which is a growth scan and also a presentation scan. Just like the name implies, what is done here is to check whether your baby is growing well. So from the second trimester anomaly scan, anything that is seen is double checked at this time. If there weren't things seen at the second trimester anomaly scan, during this particular scan, they might pick them up. Also, there are certain anomalies that develop later in pregnancy, so they are better visualized in third trimester. During your growth scan, these are things that are checked. The presentation of your baby, whether your baby is laying head down or head up. Amniotic fluid, which is the water surrounding the baby in the womb, whether it is within the normal limit or not. Your baby's size. This is not the time to check whether you are 30 or 21 weeks pregnant, because you already have those information from your first trimester scan. This is actually the time to know whether your baby has grown well during the pregnancy. Also, placenta localization is very important, because if at this time you still have placenta previa or low-lying placenta, then you might start making preparation for cesarean section. This scan is usually done from between 34 weeks to 37 weeks pregnancy, because at that time you are preparing for your baby to come. So if you are pregnant, you can attend all these scans. Have the opportunity to go for as many scans as deemed necessary in your pregnancy. So it is not confined to these 4 scans that I've mentioned. Some people might attend biophysical profile scan within 26 weeks. If you are concerned during your pregnancy, for example, you are bleeding, you are having pain, you can still go for scan. If you have gestational diabetes, you might need to go for further scans. If you have preeclampsia, then you might also need to go for further scans. Those who are pregnant for twin babies or they have had a previous pregnancy poor outcome might require to go for more scans than the ones that I've just mentioned. But these are the 4 most important scans that you might need to attend when you are pregnant. And I hope this video helps all of you. I am still your Wonga Nation president, and I will see you all in my next video.